Hi everybody, Dr. Suneel Dhand, internal medicine physician. The Delta wave of COVID-19 is currently sweeping through the United States. It's causing a lot of alarm. We're seeing a lot of news stories. Obviously, certain regions of the US are affected more than others. And a lot of people are wondering what's going on and when the wave is likely to peak. Already we're seeing a few regions of the United States increase their level of COVID-19 restrictions. And I thought an interesting thing to do would be to compare what's happening now with COVID-19 to what happened with the Delta wave in the United Kingdom. Because what happens in the UK typically follows in the United States about 2 to 6 weeks later. We've seen this happen repeatedly over the last 18 months or so. In the United Kingdom, the Delta wave was hitting in June and July. And the United Kingdom government relaxed all COVID-19 restrictions in the middle of July. It was actually scheduled to happen at the end of June, but they pushed it back to the middle of July. And there were a lot of experts, a lot of medical authorities and scientists that were warning of complete apocalypse if the UK government did this. But then, afterwards, something remarkable happened. COVID-19 cases rapidly plummeted. And this was also reported across the media, with a lot of authorities saying they didn't know why this had happened and what exactly was going on. Why were COVID-19 cases plummeting when the UK had just relaxed restrictions? Now, the answer to this is very likely the fact that the UK was already reaching its COVID-19 peak. I refer you to a physician by the name of Dr. William Farr, and he was a very prominent physician in Victorian England. He's actually a very interesting gentleman, was born into a poor family, rose up to become a famous doctor, and he was a leader in the field of epidemiology and statistics. I encourage you to read up about Dr. William Farr. And he actually made a mathematical model for how epidemics work, and we call it Farr's law. And it has been talked about by some during COVID-19, but not enough really, because what he found was that epidemics, pandemics follow very predictable patterns. And once a peak is reached, the pandemic curve falls in a mathematical way. And all we can do as humans is do our best to negate the effects of any epidemic or pandemic using the resources we have. But read up about that as well. Very interesting, Farr's law. And if we look at the pandemic curves in the UK and US, what we saw in the UK was that the peak that was reached was less than the peak during the winter of 2020-2021. And hopefully that will be the case in the United States as well, if we're following this pattern of the US being about 2 to 6 weeks behind the UK. And that's why I do smile a bit when I see people in their social media bubbles or people in their towns thinking that they can separate themselves off from the rest of the world. This is basically impossible to do. We've seen this time and again over the last 18 months. What starts in the east quickly spreads to the west. And the only way, theoretically, that you can stop this from happening is to completely shut off the borders of your country. And that includes to any airline traffic or shipping traffic, which is impossible to happen. Look at what's happening to Australia and New Zealand. They're just about as isolated as you can get. They are in total control of their borders. And even they have struggled, and COVID-19 has sneaked into the country. This is the reality of the respiratory virus that we are dealing with here. So let's think here again about the Delta wave and where we're at in the United States. Now, our job as doctors and scientists should always be to step back from the data and look at things objectively. This is sadly becoming a lost art. Frequently, people want to jump on bandwagons, want to jump to conclusions, often to confirm their own biases, when actually what we should be doing whenever we're presented with any data is think about whether there are any other factors involved in getting to that data point. And with the Delta wave, the way it is right now in the United States, these are the factors that I can think of. Number one is the weather is having a big effect here. The southern United States is much warmer than the north. And what happens in very hot weather, people are driven indoors. And COVID-19, like lots of respiratory viruses, almost exclusively spreads indoors, almost exclusively. And those indoor environments are perfect for viral spread. And right now in the south, people are driven indoors by the hot weather. They want to be in air conditioning, and that is very likely playing a big part, as opposed to the north, where people are outdoors more. Other factors involved, it's school vacation time. Could this newer variant of COVID-19 be less potent than the previous variants? Typically, when viruses mutate, they become less potent and cause less severe illness. And we hope that this is the case with COVID-19, where we're seeing more cases but fewer hospitalizations than during previous peaks. Then there's the vaccination issue. States in the south are less vaccinated than the states in the north. And my concern is that many of the unvaccinated people are not 25-year-old athletes in perfect health. They are people who are in those vulnerable groups that I've talked about frequently in my previous videos. The elderly, those with chronic diseases like diabetes, lung disease, and those who are overweight and obese. All of these are very significant risk factors for getting a more severe case of COVID-19. Are there any other factors involved right now in the patterns we're seeing in the United States? There could be. Let me know if you can think of any others down below in the comment section. Remember, science and medicine is about open, free debate. Things can change very quickly with COVID-19. We've seen this repeatedly over the last 18 months or so. But if the US is following the UK pattern here, 2 to 6 weeks delay, then we very likely will reach a peak soon and we could well see a rapid decline very quickly. I certainly hope so. And in the meantime, of course, it's important to stay vigilant, especially if you are in an area with high COVID-19 rates and transmission. Stay razor focused, especially on those vulnerable groups first. Do everything to protect them and take sensible precautions. And if you're the type of person that watches the tickers on the news of COVID-19 cases, certainly wouldn't recommend that. It's not good for one's mental health. But if you are that type of person and is stressed and anxious with what you're seeing, rest assured that if we are following the UK here, we are very likely to reach a peak very soon, and then cases will start declining after that. Thanks everyone for listening. Dr. Suneel Dhand, MedStoic Lifestyle Medicine. We will speak again very soon.